push that over here.
Hi everyone, I'm Sahar Ahmad from New York, Stony Brook Medical Center. I represent Group 1, which was mentored by Chris Fox. We're talking incredibly briefly about implementation of ultrasound into the first year medical student's curriculum now. The first year medical student, a very special animal, just right out of college, no real knowledge yet, not just of ultrasound, but of the human body at all. And so a very important privilege to introduce this first year student to ultrasound. Now, in terms of needs assessment and identification of a potential problem list for this endeavor, of course, time is always of essence and is always lacking. Currently, we have no real standards for ultrasound training at this level of first year medical students, and we still do have a lack of champions and instructors. These are barriers which will probably be evident in all facets of ultrasound education, is my guess. In terms of a needs assessment, very simply, we would plan to put out a survey of the current first years who do not have ultrasound training. And we anticipate hearing back that the survey shows that the students have no experience with ultrasound and do not know of any curriculum for them. We do think that it'll be very important to maintain a consistent presence throughout the first year of medical school in terms of bringing the students to experience ultrasound. And we think it'll be important towards the end of the year to look at targeted approaches for preparing students towards residencies. Specific goals and objectives for first year medical student ultrasound are as follows. First and foremost, again, because we would be the very first introduction to ultrasound as an imaging modality, we would want them to be introduced relatively formally. We would institute a mini course at the very start of medical school. We would utilize asynchronous learning, especially the use of online modules and podcasts. This helps to relieve some of the faculty time. Specific objectives for this mini course are listed here. To review the benefits to the physician and to the patient, ultrasound safety and etiquette of use and addressing a patient, pneumology, of course, basic ultrasound image acquisition and scan plane development, and the recognition of some basic normal ultrasound findings. As we move on towards the course of anatomy, which classically is presented relatively early in the first year, we would plan to teach ultrasound organ by organ in a systematic approach which parallels the anatomy course. Same thing with respect to physiology, if that exists early in your first year curricula, and same thing with respect to the initiation of the students learning physical diagnosis. Right along with that, they would learn ultrasound approach to physical diagnosis. We've listed some educational strategies that we anticipate will be successful. I think the use of pre-course work, especially in the form of podcasts and online modules, will be very important. Those modules and podcasts would have to precede their ultrasound sessions. Simulation, similarly, will be an invaluable resource, again, to come over the barrier of the absence or the lack of faculty resources. We, as a group consensus, decided that the students participating as models for each other will be something that we would promote. We find that it would save costs in terms of utilization of standardized patients. It would enhance learning and teamwork. And it would teach the few nuances of ultrasound, for example, how much pressure to project onto your patient that would be otherwise difficult to teach. We would expect the students to sign some pre-written waivers, and we would expect to produce and implement an incidental finding policy. Ultrasound would be taught alongside anatomy and physiology courses. Again, a parallel design with what organs are being covered. And we promote the institution and the sending of our students to various UltraFest and related programs throughout the nation. Some implementation strategies are listed here. Between the first and second year is really an excellent time to utilize for summer and elective courses. That's very unique because that essentially is the last summer that these students have that would be free. Ultrasound super users who can then be brought back in to help teach the class will be identified. Simulation, again, will play an integral role throughout the year. Utilization of student models. The students won't be forced to do this, of course, but we believe that many of them will be more than willing to participate. And there's a benefit for them to be the ones being scanned. Finally, evaluation is always a difficult topic to approach, competency of ultrasound, because the learner is not just interpreting or reading or performing. In fact, they're doing all of the above. Makes it relevant that you address the competency in a sort of a very comprehensive manner. We would utilize pre-test and post-test data. OSCE is an excellent modality. With respect to OSCEs, we would integrate the use of ultrasound into already present OSCEs. For example, adding in ultrasound motivations within the physical diagnosis OSCE that may already exist. Thank you for your time.